You're the one living your life. You're the one making meaning out of your life, and you can choose who you want to be on that adventure with you.
There's a moment in a lot of health journeys where you realize no one knows your body better than you. In this episode, I sit down with Dr. Michal Waldfogel, ND, to explore how hormones act as messengers, why ferritin is often overlooked in iron deficiency, how methylation affects B12 and folate, and why cycle awareness can support long-term health through perimenopause and menopause. This episode is for anyone who wants to understand their body more clearly and feel more empowered in their healthcare. Hey, Michal. I'm so excited to dive deep into the embodied world of naturopathy, of touch, of hormones, of minerals, of perimenopause, menopause, and just see where this conversation unfolds. So hello.
Such a pleasure to be here with you.
Yay. So I'll just let you get started. What is coming to the surface? What is exciting, inspiring to you at this moment?
Yes. Was it exciting, inspiring to me at this moment, and I think where we very much agree, is facilitating someone's own confidence, embodiment, autonomy, and a belief that they can heal themselves. Knowing also, of course, when to get support, but just that piece, the more and more that I practice, I feel like I'm there as a support for the healing to happen. And the biggest shifts happen when someone really feels empowered about their health.
And to feel empowered with your health, what do you believe is the first step?
I think the first step, and there's a lot of roads lead to empowerment, but the first thing that comes to mind is knowing that you are the most important person in your healthcare team. Your doctors, your other healthcare practitioners are there as resources and actually work for you, no matter what system you're in, and that you are the continuity of care among all of these providers. Really knowing that you can come to the table with information, with questions. You can keep your information for yourself, and to know and learn how to communicate that feels like an important first step.
So feeling comfortable sharing your story, having a dialogue with someone, just feeling safe when you enter into a conversation, a relationship with your caregiver or caretaker provider.
Yeah, and depending on the situation, sometimes it's a little bit transactional. You have something you need from this person, whether it's a imaging report or whatever it is, or their expertise to look at something, but to know that as long as having the resources so that you're able to enter that visit grounded and to breathe and to know that you're there and you have the information, you can ask direct questions and help them also. They're really stressed, probably those healthcare providers. Help them serve you and support you the best that they can.
Yeah, a story comes to mind of one of my healthcare providers on my journey of menopause. And I was at the end of my road. I felt really helpless. Every doctor that I went to go see, endocrinologist, GP, and like fertility specialist, really was just telling me the same thing. You're in menopause, that's what we see. And I went to this ultrasound technician, and he looked at my ovaries and he said, "Look, I don't see any follicles, but your ovaries are really good shape and size. And so our machines can only see what they see, and we can see follicles, but we can't see the primordial follicles. And medicine can only take you so far." And it was like the exhale. It was the moment where I was like, oh, my intuition of knowing that, hey, something is not making sense in my diagnosis, and knowing that medicine can only take me so far was the bridge to unlocking my own journey of health. So I love that you're saying, if it's transactional, if it's finding someone that you really trust, support your own first person
Yes.
in your team.
Yes. Because how do we know what we know? That's a great example of the technician. I've heard this metaphor that if we try to look for music on a CD using a chemical analysis, we're not going to find it because we're using a tool that doesn't show what we're looking for. And so we get information in a lot of different ways. We might get it from lab tests, we might get it from imaging, we might get it from just telling our story and someone can help us connect the dots. We might get it because every time we're in a certain situation, we get butterflies or stomach ache, or starting to notice things that if we start tracking the cycle, that seeing, oh, I thought I was depressed, but it's always right before I get my period. So maybe there's something else there happening. And so there's just a lot of ways to get information. And so to know that ultimately it's up to you about how you want to understand that information, how you integrate it, how you also bring your own knowing and intuition into play, and having resources to help put that together. Because you're the one living your life, you're the one making meaning out of your life, and you can choose who you want to be on that adventure with you.
I love that. I love hearing like you are the one making meaning of your life. And I also love connecting the dot of the sentence of right before your period, maybe you don't feel good, something's happening. And so there's messengers, right? And so can we talk about hormones are messengers and they're also providing meaning, and to how to look into them?
Yeah. We are miracles. The body is, and mind and spirit, everything, it's the same, is, I guess, complex, sophisticated, and really conspiring for our good. Ultimately, our body's always trying to, and I'm using the word body, I mean everything, shorthand for now, we'll say body, is wanting to heal. It's saying, okay, here we are in this world, and let's be adaptable, resilient to whatever comes our way. Because we can't really control everything that happens. That's how we evolve. That's how we survive throughout the millennia as humans, is that we can handle things we've never seen before. And that's what the body's doing. And so we have pathways to take information, or take, whether it's a physical or emotional source of a stressor, let's say, into our body, to be able to process it, metabolize it, break it down, and take in, absorb maybe what could be helpful, but then release what is not helpful. And so when our body is working well and we take away things and we support it with things that allow for that, then we can handle whatever comes our way. We don't need to be locked up and avoid all of these things. We can really fully be present and enjoy everything that life has to offer. Also to note, speaking, that for some people that might look a very different way, and I don't want to say that this way of health is better than this way of health. And some people have very, very real limitations, physically, emotionally, mentally, in their bodies, in their life, for various reasons. And their health might look a very different way. So I just wanted to put that as a statement, that we're not looking for optimal, on a mountain meditating kind of health. We're looking at what makes sense for you and what is meaningful for you in your life. In terms of specifically hormones, it's hard to separate though, because when you think of the hormones, speak with the nervous system, it speaks with neurotransmitters, it speaks with all parts of the body. But ultimately, it's messengers. It's communicating. It's giving information to say, hey, we need more of this or less of this. And when it works well, it's like you go to a show and everything's working well. You don't realize, but if the curtain doesn't come down or something's going on, you're like, oh, shoot, what's happening here? So if it's working well, like, you don't notice it. And I think that's part of, sometimes we have these health issues or crises that are like, whoa, for the first time in my whole life, I had to start paying attention to this because someone didn't pull the curtain down and someone wasn't listening.
So if a woman is getting depressed right before her cycle, what might be the hormones be messaging to her body? And what would you want to look at, like on a screen, on a lab, or just send her for blood tests for?
Great question. So for a lot of people, it's very common before you get your period, that there might be some issues of premenstrual syndrome. So like that can be anxiety, depression, and there's physical symptoms too. Sometimes that can be very severe, and some people go into deeper depression during the time. There could be suicidal ideation. It's very important to work with a provider in that case. So it's a very wide range. And that condition, PMDD, is similar but not exactly the same conversation as mental health issues in this time. There's a lot of factors, but during this time is part of the cycle. There are a lot of cycles in mental health. Just to say, there's day and night cycles, right? There's year cycles. So a lot of people also in the winter have more tendency to get depressed, and that's shorter days, also lower vitamin D. And then also all of those two things have an effect on serotonin, which is the neurotransmitter, the brain chemical that has a lot to do with feeling happy, feeling like you don't have ruminating thoughts, feeling like you aren't dwelling in perfectionism and things like that. And so that's a cycle there. In terms of the menstrual cycle, right before your period is also a time where serotonin can dip. It can be related to hormones like estrogen and progesterone as well. Specifically, estrogen, the shift in estrogen can decrease serotonin levels. It's a time then also, I'll add to that, that it's a time of month that if people have certain cravings or addictions, that's a time where they might be more pronounced. I did a work in recovery centers for addiction and alcohol recovery, mental health, and that was the time where there's a big risk for relapse. For example, if someone was using alcohol in a way that wasn't kind of sustainable for their health, then that was a time. It's also a time where we might crave sweets and chocolates and things like that, which is fine. It's great if you get that. But you know, that's often has to do with the serotonin dip. And so that might be a time to support your neurotransmitters generally, which is through protein, amino acids. So that's a time where making sure that you're nourishing yourself, that you're getting what you need through your food, maybe even helping the building blocks of serotonin, getting that in during that time if that's an issue for you, for example.
Okay, I love that. And would you also consider, let's say, like lifestyle factors? So how they're sleeping, how they're, you said eating, their circadian rhythm, how they're waking, how much light they're getting, that impact serotonin levels?
Oh yeah, for sure.
Okay.
Yeah. So serotonin also is the precursor to melatonin, which you know is what we need for sleep. So it affects, all of it gets affected. Also having the daylight and having maybe in the winter, if you get the seasonal affective disorder picture in your life, that having a light, like one of the sun lamps and first thing in the morning to help reset your clock can be really helpful too. And making sure you have enough vitamin D, which is part of all of these processes. So yes, all of that is helpful. And also to know that like having that balm, like the healing balm of also it's okay if all these things aren't perfect, right? Like we can also find other ways to do it. And so maybe choosing one thing to focus on to be like, all right, you know what? I'm not going to think about anything else, but I'm going to make sure the week before my period that when I'm feeling great the rest of the month, I'm going to put some stuff in my freezer and have some extra meals and make sure that I'm like getting 3 meals a day or something. Whatever thing it is to make sure that it works for you in your life and not some other person who has a completely different life and situation than you.
That makes so much sense. Like the animal that is going to hibernate for the winter, make sure that they work and store all the things that they need for the hibernation time. So if you're really good for the 3 weeks and the 4 days right before your period, things are going down, it's like you've already done all the work. Make sure that's prepped for so you don't have to think about it. I love that wonderful takeaway and how like low hanging fruit that is, especially if you're feeling really energized during that time.
Also, I love what the work that you're doing of helping people get more awareness around their cycle so they know when those days are, or they can prepare for that. And to be, that can be part of the routine and rituals. Oh, I can tell that I'm here now in my luteal phase and let's get cooking or something like that.
Yeah, I think awareness is the first step into embodiment. Some people feel embodied right away, but sometimes we need to understand the why before we can get deeper inside. Something that we were talking about a little bit earlier before we pressed record was during the menstrual phase. You were talking about donating blood and how in different parts of our cycle maybe are more supportive than others, and how during the bleeding phase it might be unsupportive. Can you please talk more about that and how we can ensure that we're supporting and being able to give and donate if we choose to?
Yeah, it's a really good question, and one that I've seen cause some harm. We want to be able to give from our overflow, and when we go to give blood, if that's part of our practice, they'll check your hemoglobin, which is the status of your blood cells in the moment. The thing is that that measure doesn't necessarily show what your iron stores are. And so it can falsely show that so it shows technically you don't have anemia. You don't have the definition of anemia, but you could still be iron deficient even though it's not showing as anemia. So I really recommend that when you're getting your blood test to request a ferritin reading. Ferritin is the blood's iron stores. And so what that shows is that, for example, if that is on the lower end, then if you're giving blood, it might then deplete your iron stores and then lead towards anemia, for example. If you're giving blood right before your period, also your body didn't necessarily have, or right after especially, your body doesn't have the time to rebuild the stores in between. So I'm not sure exactly the amount of time you can give between when you can give blood, but I really recommend that before you have a regular practice of that if you are a menstruating person, that you check your ferritin to make sure you're getting that up more. But another interesting question is when you test that, because are you testing it right before you bleed or right after? And that'll change things too. I had someone who had a very low ferritin to this point where we wanted to have an IV infusion for her, even though her hemoglobin was within normal range. So the technical diagnosis is iron deficiency without anemia. And so I actually recommended that for her, like we were trying to get, this is in the States, so get her insurance to cover it. And so I said, actually, if they're making you test it again, because we've already had one test, if they want you to test again, do it right after your period, because then that'll actually support even more that you need this. So a little bit using it to our advantage in that case, in the weird American healthcare system.
Love it. I love it.
But to the point that your iron stores might look different at different parts of before or after you're bleeding and how much you're recovering from bleeding. A lot of people feel a lot of low energy the first few days of their cycle, especially if they have heavy bleeding. And that's there's different reasons for it hormonally, but I also see that's a time where if someone is maybe doesn't have anemia, but then has iron deficiency without anemia, then their stores really deplete during the time and they get extra tired. Big cause of fatigue in people who menstruate is iron deficiency.
In terms of the giving blood, how long, if they were to do it during the bleed, how long would it take their body to recover, and would it affect their next bleed?
It's a really good question. I don't have the data on how donating blood affects the next bleed. It also is really individual in terms of what your stores are like to begin with. However, it really, I think, it takes retesting to see what works for you. Because first of all, if you're diagnosed with iron deficiency, first of all, if you have fatigue and then we find out you're iron deficient, okay, the symptom was fatigue, and okay, why are you tired? Are you sleeping? Whatever. Okay, but also you have iron deficiency. Low-hanging fruit. Let's take care of that. And you were figuring it out. Maybe we're starting to supplement it for 6 to 8 weeks, retest, and maybe it's not shifting too much. Maybe there's an absorption issue, and that's what's going on. Maybe there's so we have to work on some intestinal health restoration project help with that. I've never said it like that before. I don't know why I said it like that. Okay. But then, or it could be because you're bleeding a lot. Maybe there's fibroids that are causing heavy bleeding. Maybe you are just not getting it in. Maybe you haven't supplemented and you're just not eating a lot of iron because you're a vegetarian or because you don't eat red meat. There's a lot of reasons for that. It could also be that you have an excess of zinc, and which blocks absorption of iron. So there's a lot of different things. Or you take your iron with coffee or calcium and that blocks the absorption. And not to get in the weeds of do what works for you, but if you're trying to get really when's the best absorption, give me a form. So I usually recommend iron bisglycinate as a form that's very highly absorbable, non-constipating, and people tolerate it really well. So for example, having the right dose for the right amount of time, there's some studies, and we can link, or I can get that for you, where they say actually repleting iron every other day instead of every day, there's better absorption. So there's interesting ways to think about it. So if doing it one way isn't working, it doesn't mean that's not working. It could be there's another way to try it.
I love how phasic the body is and how sometimes daily isn't the cycle that we need. And so it's really important to understand how the body likes to absorb different nutrients and minerals. When someone is anemic or low in iron, ferritin, how many times per, let's say, season or month, should they be testing to see if it's coming back, if what you've given them in terms of supplements or food or however the prescription was, how many, like, wow, I can't get this question out. Okay. How?
Maybe you need some iron.
Yeah, maybe I need some iron. My brain fog. Yeah. How many, like, when should they be retesting to see if their iron levels are coming up with the prescription that you provided?
I like to test within 6 to 8 weeks.
Okay.
So,
simple.
yeah.
Go every 6 to 8 weeks.
Yeah. But it's like, if you do that and you see it's trending in a certain direction and you can see, okay, I used this much and this is as many points as it went up, but then you can be like, okay, it's trending up. You can see, so you can navigate it from there.
And then I have another question. So let's say you don't get retested. You went to see a healthcare provider. They told you had anemia. They gave you a prescription for iron. You decided to take it, and then you just keep taking it. Are there repercussions to those actions? Are there side effects to having too much iron in the body?
Yes. You don't see it so often. If someone's menstruating, you might see it another time. There are health conditions where people make too much iron anyway, and that sometimes is masked when they're menstruating. And I've seen that. I had a patient who, when she stopped bleeding in menopause, that it started noticing that she had a familial condition that she was making too much iron. So if you're taking a dose of iron supplement in a repletion protocol, is very different than having a maintenance dose or something like that. So it is really important to know the difference and to get a sense of it. And also, I think it's important to have when I'm working with patients, have some guidelines to be like, this is the realm of what's safe, and you can see what works for you. Because in the real world, we forget to take our supplements sometimes, or we go on vacation or whatever. And it's like, you need to have space for that and be able to know, let me have enough information that I can also make my own choices and decisions that feel okay.
So if someone starts to feel better and they have their energy up, they're no longer in brain fog, they just feel good on a day-to-day. So recommended that they maybe slow down their dosage, or even if their intuitions, I feel like my body's we worked it out and it's coming back to its natural understanding of how to process, absorb iron, we would just simply stop and there's no effect.
It also depends if you were doing the next level of inquiry of why are you iron deficient? Is it only because of the menstruation? If you're in a certain age bracket, we want to make sure it's not coming out in stool. So having that test make sure that you don't have any blood in the stool, for example, just good thing to rule out. And then are there any other digestive issues happening? A lot of people create a new baseline that they're like, oh yeah, I just have pain every time I eat this thing. And they're like, that's just my life. Or I just always have cramps and bloating and stuff in my cycle, and that's just normal. And I just have to take a day off work every month or whatever. But to be able to be like, all right, why is that happening? That doesn't necessarily happen for everyone. Maybe it's that's your family history and there's a certain susceptibility and that's more likely to happen. And we can talk about how to manage that too. But all of these is information from our body, and so our body shorthand, yeah. But so the question was about, do you stay on it? So if you've resolved the issue, or if you, for example, were taking medication that was blocking the absorption of iron and you stopped taking it, it's that changes things too. So I'm saying it depends.
Yeah, it depends. I get that. One of the things that you said that I want to go back to is the zinc iron compatibility, I would say, because let's say phase living, in cyclic living, we are recommended is zinc at the beginning of the cycle to boot up the system again, to build the system again. And so is it when you eat it, just maybe short answered question, is it when you eat it together, or is it eating too much of zinc will stop the absorption of iron?
Yeah, I generally say take it at different times a day. And that can be annoying because sometimes I'm only going to take in the morning. And then I'll be like, okay, but maybe you're going to need a little bit of extra iron because zinc might block the absorption a little bit. And then sometimes I see these multivitamins that have zinc and iron in it and calcium, and I'm like, I don't know, maybe that's okay. I don't know. But this is just, and how do we know what we know? So maybe it's different for different people, the way they are able to absorb different things. I'd say if you are taking these things, when you take it, give yourself a blessing and just say that you're going to absorb exactly what you need for your health and well-being, and why not?
Just close your eyes.
Yeah.
And hope for the best.
This is your medicine. So if you put the trust in it. So it's, yes, but there is that relationship that to be aware of, and that can affect how that shows up.
Okay. And then I want to talk about like methylation in terms of absorbing the minerals, vitamins, and because a lot of people,
They're not able to absorb certain nutrients like B vitamins, for example.
yeah, because they just
B12
don't have
folate.
the key. How do we find out what we're able to actually ingest and what we need to eat in its like primordial form?
Yeah, really good question. I think it's also very buzzy, but the methylation and stuff. A methyl group is just extra like carbon and hydrogens tacked on it, like way to like tag a molecule. In this case, you're tagging B12 vitamin or folate vitamin, or the primary methylated vitamins. It also, I'm really glad you asked this question, because in addition to iron to build blood cells, we also need B12 and folate. And this is something that you didn't ask this question, but I'm going to answer.
Please,
I'm going to
please.
answer the question that you didn't even know you're asking, which is that it can be, it's not just iron, it could also be B12 and folate deficiencies that affect, in that case, anemia. So it could be, there are different causes of anemia. One could be iron deficiency, one could be B12 folate deficiency, another could be what's called pernicious anemia that has to do usually with like autoimmune diseases. And so there's different reasons why that shows up. So it's important to figure out what is the cause. So if you're notice that you have anemia without, and it's not the iron deficiency cause, and you just give more iron because you're like, oh, I'm anemic, I need iron. But actually it's the B12 and folate you're not getting for various reasons. One of which might be that you are among many people who have what's called a polymorphism. It's like a different, it's not even a mutation because it's so common. So it's a different way in that gene that processes the ability to absorb these nutrients and use them. That means that you want to take it pre-packaged with the methyl group so that you can use it better. All this to say, none of this should feel stressful. Also, your body knows what to do, and it might not even come into play. So if you're getting, and your body is absorbing through, and it's able to process some of it normally, and you're actually like a really chill person, right? Like most people, they're super not stressed. Sometimes in periods of higher stress, though, you have more demands for B12 and folate, for example, to filter through different pathways, and that causes that gungs up the system. That causes some more distress that you might need this other form. I wonder if it's like this metaphor works, but maybe you can use regular gasoline at the pump, but you need the like extra special clean diesel fuel when things are tougher. So you can tell also in basic lab work indications of whether there's like an iron deficiency picture or a B12 folate picture. You can also test these nutrients in basic blood tests too. And then there's some other kind of markers that might be nice to have. And these are things that most conventional doctors can order. I'm happy to share my list now, or
Yeah, you could share it now. You can send it to me. Yeah.
I like to look at, for sure, like the red blood cell count. This is on a regular lab test. And then looking at the MCV, which is mean corpuscular volume. And that says the average body volume, right? It's mean corpuscular volume. So it's how big is the blood cell? Because often if it's very little microcytic, then it shows that there's an iron deficiency. And if it's very big macrocytic, then it's a B12 or folate deficiency. And so you can see these values. If like you have indication that there's some type of anemia and it's in the middle, you might be like, oh, maybe it's a mean, it's an average, so maybe it's actually both. And so just getting a little bit of information from that. You can also then test B12 and folate in the blood. If you're testing B12, I also like to look at another marker called MMA, methylmalonic acid, which gives some extra indication about the vitamin B12. And then there's another marker called homocysteine, which is one of those byproducts of one of those cycles that uses B12, and that shows that if it's backed up, it's not able to, doesn't have enough of the material of the B12 to run through the system, so it backs up homocysteine. That marker, some people have heard that before, can be a predictor of cardiovascular issues, and so it's very important to notice that early on so that you're not causing more and more progressed issues with that. So oftentimes when I see that picture, without even doing a genetic test, I'm like, you know what, that kind of looks like methylation issue. And we can say, you know what, let's try the methylers. There are some providers who are super deep in the weeds with this and will need to know the genetics of it. It's pretty affordable to do that if you want to test the MTHFR polymorph.
The mother.
What's that?
The mother.
And I love geeky science stuff. But yeah, it's like, test things out and see how you feel. There are some people who the methyl group actually doesn't make them feel good. And so you can backpedal that or notice other things. I always suggest start low and go slow. Mm-hmm. So I have a lot of folks I work with who have sensitivities to medication, to supplements, a lot of things. So I'm like, what's the smallest form? I might even like start with a powder form so you can really test that out, or open up a cap and take the smallest amount if you know that you're sensitive to certain things. And that's great. It's great to have that feedback in your body.
Method.
Please.
I don't want to cut you off. I feel like this is such good information. I wanted to keep rolling.
Yeah, you don't have to, you can really ask. You know yourself best, right? So if your provider's like, oh, start 2 of these 3 times a day, you're like, oh, actually, some of them sensitive things. Could I start with a half a cap once a day and see how I do? And then do. So if they're not providing that, you can ask if that's okay. Or you could, if it's something like that, you're building up your tolerance to it, or you're seeing how you feel, then that's usually okay. You're doing less than they ask. But I think that's really important, especially if you know that you tend to react to things, to ask to go slow with it. And as another reason why you are the most important person in your healthcare team, and you bring in all of these experiences, because your healthcare provider in front of you might not be tracking all this. And they might be seeing a lot of people before you and not keeping all the pieces together. And in the ideal world, that would be amazing to have that. And in our world, we're working with what we have, and it's great.
And I think it's such a beautiful way of approaching like supplements or any type of healthcare, because I also find like in a cyclic woman, if you're still menstruating, your sex hormones are creating a lot of fluctuations in your body and are dilating or constricting your vessels. And so a lot of ways that so in certain parts of our cycle, if we're ingesting something, it might affect us differently than if we're in a different phase. And so it is important to just see where you're at and how it affects you in certain ways. And what I like to tell my students is menstruating women, if you've ever menstruated, you start to become aware of the fluctuations of yourself. So you're privy to an inner world because you have to be aware. So you start to become aware of these cycles. So you become aware of how you feel on certain foods, on certain lifestyle habits, and those things become the messengers to you. And, it sucks to be the person that's always aware, because you always have to open the door, but it's also a gift because it allows you to be the first person in your medical team to understand where you are. One thing that you said, and I'm going to forget that, but the signal for the cardiovascular problems, I would love to dive into that one.
The one that I was referencing is called homocysteine.
Homocysteine.
Yeah.
So referencing homocysteine and asking like does it have a relationship with estrogen, or do you know of a relationship with estrogen? Because I've done a lot of research on how estrogen can impact cardiovascular symptoms in perimenopause and menopause women. And so it's a 2-part question. It's like, how closely do they relate? And also, I know no stress in taking care of yourself if you don't have big symptoms, things, it's not like you got to have perfect markers on everything. But how much of how we take care of ourselves during our cycling years impact how we feel in our perimenopause and menopausal years?
So I'll do the first part of the question first, which is, I don't know. That's a great question, how estrogen and homocysteine are related. Homocysteine is a sort of molecule byproduct of a cycle that's one of the detoxification pathways. And so I can imagine that, it's affected in a lot of ways. Again, when we have more stress in our system, we need to do more of that work. And if you've had an undiscovered MTHFR polymorphism, a methylation issue your whole life, that it could be something that you're not able to break down and process and release. And so it could affect the way that also estrogen is observed, like used in the body and all of that. So I can't picture where it fits in the diagram. Let's look into it.
Yeah, please.
So then the second part about the menstruating years leading in towards perimenopause and menopause. As you were speaking, I was just thinking of this saying, it's easier to learn how to swim in the shallow end than in the deep end or whatever. So that I wonder that the menstruating years even are an opportunity to learn how to swim in your body. Also, this metaphor of water, right, that you bring up so much too, which is beautiful. Learning how to swim and getting your strokes in and making sure that you're safe and making sure all of this, so that when we get into the deep end of a lot of the shifts and changes that are happening during perimenopause into menopause, that we have routines, we have structures, we have things that maybe need to shift a bit, but we've already been giving attention, and we're not out there flailing our arms because we've just been so overwhelmed and getting these signals from our bodies that things are not.
And we're listening to them, or we're checking in on them.
Exactly.
Yeah. I love that. I love that metaphor. I think it is a really beautiful metaphor. And yeah, just to take time to get to know yourself. I think it cycles so beautifully back to the beginning of the conversation of just really getting to know yourself. That's ultimately what we're here to do, right? It's like you're your first primary person, you're your first primary caregiver, and like really embodying yourself to know your truth and to know your health status, and to listen to those little messages and be like, is it important that I go to see someone or have support in this way, or is this something that like it's not something to stress about yet? And then ultimately making that decision for yourself, so that you know that the healthier, happier you are in your daily life now will lead to a happier, healthier life tomorrow.
Yeah.
So thank you
Yes.
so much. This conversation was incredible. I learned so much.
So fun.
And I'm so excited for my listeners to listen to it too. So thank you.
Yes.
Yay.
So good.
Yay.